we went on the street to talk to a lot of people, and one of their concerns is they feel that the inoculation program is too slow.
It depends on where the question came from. If the question came from people who got infected or people who relate with those patients, of course they will have to say it's too slow. If we refer to the agreement that we have purchased the vaccines with our suppliers, it is timely. According to the contracts that we signed, AstraZeneca, who is the principal vaccines for Thailand at present, will begin to supply its products from June 1st onward. June 1st.
Is this the one manufacturing in Thailand or the one?
Yes. And we signed a contract since October last year. So in October last year, we were able to control the situation quite satisfactory. So that means we were not careless. We purchased these vaccines during the time that we had no domestic infections at all. So what does it imply? It implies that we were ready all the time. So we were able to convince the vaccine makers to establish the production line in Thailand. Why we have to do that? Because we want to be as certain that the production of vaccines is at our arm reach. And once we have this production facility based in our own country, so it guarantees that we will never be short of vaccines. But however, isn't it because of the government being so well prepared? So that's why once there were 2 major outbreaks taking place in a very short period of time, the health system is still prevail. So we have to give a credit to the health system of this country that despite not having local infections at all for a period of almost half a year, we still prepare ourselves for the worst. And we hope that the worst must have come already. And once we are able to get by this cycle of infections, which began at the beginning of April, together with vaccines, as I said before, formations of hospitals, as well as the field hospitals, and experiences that our health workers have gained throughout the period of time. We hope that the situation can only get better.
So now there is a question of the vaccination for foreigners in Thailand. We know migrant workers has been inoculated in some areas. We know that the public health ministry policy said that it covers foreigners in Thailand, everybody in the kingdom of Thailand. But what is the process? How do you make it accessible for foreigners?
First and foremost, we have declared clearly that we will vaccinate all people living in this country. So it is clear that we will not just vaccinate Thai people, we will vaccinate everyone who lives in this country. So the way of them being registered will have to be determined. Many of them are diplomats. We will have to establish channel for diplomatic staffs, including people who work as expats to this place. So they all will have to belong to a certain organization or association. The easiest way for them is to come through the channel of their respective organizations.
What if it's the family of the expat or the expat that has been in retirement in Thailand?
Well, haven't you heard I said, we will give vaccines to everyone who lives in Thailand. So we will have to establish a proper channel for them to come and get vaccines. Vaccinations will be given in various applications. People could do the online appointment. People could register themselves manually. And I have added a walk-in facility. And we believe that with the amount of vaccines that will come in tens of thousands, tens of millions doses throughout a period of 6 to 8 months, the accessibility to vaccines can't be difficult. We will work together with private hospitals who will, receive vaccines from the government, and then they will jab people who chose to visit their network. We can establish the vaccination centers using the hospitals that we are having in every province. We can modify and utilize all those few hospitals that should be over with their missions in the next few months to be the place where people could walk in and receive vaccines. We have village health volunteers that will bring people who don't have access to smartphone application. People who live in the remote area, they will gather those people through their channel and receive injections. So there are several types of vaccination facility that all we want to make sure is everyone in this soil will receive vaccines.
So then it's come the question of efficacy. How do you ensure that the vaccine we have, Sinovac and AstraZeneca right now, is
Personally, I don't ensure.
How do you ensure the public?
I have a pool of doctors
Right.
and professors of medical schools coming out and guarantee that Thailand will give proper and efficacious vaccines to its people. Every vaccine have high and low, but all in all vaccines working nicely. I haven't seen a single brand of vaccine that have no negative news. These kind of things can happen. All vaccines in the world as of this moment are still being used under emergency use authorization. All the vaccines that have been imported into Thailand must be proven by our FDA and the medical science department. What Thailand is having now is by far a very good vaccine. AstraZeneca immunization grows up very quickly, even getting the first jab. Sinovac vaccines, after 2 doses, also produces good efficacy. And we don't limit ourselves to only these 2 vaccines. Now we are dealing with many other vaccine makers who just started to send in documents and application for registration. So in the next few months, we surely will have choices of vaccines for our people.
Last question, it might sound a little bit political, but it's a question raised by some political scientists say that people that view that you are being isolated when the Prime Minister appoint a committee to oversee the vaccine procurement or the management, or when he take all the control under himself again. Why do you think they feel that way? Do you agree with their view?
As I said, they are not my colleagues. They don't know how we work. I work very closely with the Prime Minister, and I can say that I have personally assisted my people in the Ministry of Public Health to negotiate terms and conditions. When the Prime Minister appointed this new team to provide vaccine, and he called an alternate vaccine. That is for private sector. He must have understood that I work very hard, and I have been ordering vaccines for public. So he just established another working group to, provide vaccines for private sector based on their request. I don't have time to deal with private sector. I have to deal with 70 million people. I have to make sure that all of them will receive vaccines, as many as I could. So I think people will just try to look from outside that there might have been conflicts among the Minister of Health and the Prime Minister. That thing can never happen. Especially for myself, I obey the rules. And the Prime Minister is my boss. I do whatever he orders me. And I will always follow his instructions. And I will always help him to get through this period. This kind of situation, no one can fall. Either we rise together or we fail together. And failure for us is not an option. So I don't think this situation will nail us down, and we will continue to work together in the same direction and target that we will sweep this virus away for the benefit of everyone who lives in this country.